It's so good to have you on tonight. It is a Wednesday, right after primary election day. Hi, I'm Scott Mitchell, and this is Health Watch Oklahoma. This is a special one, kind of bittersweet because it's this has been something that's been going on for a long time. We have a special program for you, part nostalgia and part looking towards the future. But let me start with appreciation to my friend Ryan Wilton at News 9 News on 6, the digital chief. We have a message from him shortly, but let me bring in my partner in crime. This is a guy that I've been depending on for about 2.5 years, who I persuaded him to do something when this thing called COVID came along. Dr. Larry Bookman, it's good to see you, sir.
Thank you. It's good to be here. It's good to be back. It's been a while since we've been on, so
it has. And so what we've told people, this is kind of we're closing the chapter on what we started out by calling it COVID-19 Watch, and then it became Health Watch, and it started out as an emergency. And Dr. Bookman says it's time to move on to other things, and the Fab Four plus one, which is Fab Five, all great. So this is kind of the final one, and we wanted to make this really special because there were three guys you approached over 2 years ago to start doing this. And after millions and millions and millions of views, and every week doing this, and you doing this program, putting the show together, but you also persuaded four extraordinary individuals, four extraordinarily busy individuals who are dedicated professionals to appear with you every week. And so what we thought we would do, and one, we're making a return. And I just thought, Dr. Bookman, if you just say something about these guys as we bring them in.
Well, they're all very special, and I count them as friends as well as colleagues. So it's my honor to introduce them. First, I'd like to introduce our newest, Dr. Dale Bratzler, who is the head of the COVID response at OU, part of the public health forum. So Dr. Bratzler, who is our newest member of the Fab Four, and I thank you a lot for all you've done, especially filling in when you did. It's been amazing.
Yeah, thank you, Larry. It's been absolute honor and pleasure to get to work with all of you.
Well, thank you. Next is the past president of the Oklahoma chapter of the American Academy of Pediatrics, Dr. Dwight Sublett. Dwight has been our expert on pediatrics throughout the last 2.5 years. He's taken a lot of his time to do this, and we greatly appreciate it. So, Dwight, thank you. Thank you for all you've done.
It's been a pleasure. I appreciate being able to work with you guys. I've learned so much, and this has been such a unique experience going through this over the past couple of years that it's been quite a blessing to be with you guys, and I appreciate working with you. Thank you.
Thank you. Next is a very special person on this team. He kind of keeps us all in line and brings up what is important. Dr. John Armitage. Dr. Armitage is the CEO and president of the Oklahoma Blood Institute. And when fresh frozen plasma, convalescent plasma was so important, he was our expert explaining what it was and getting the people out to the Oklahoma Blood Institute to donate, and was very important during that period of time. So John is the one who takes the deeper look at everything, and I couldn't be prouder to call him a friend.
Well, thanks for letting me be part of this group. It's an honor to be around such smart people. I feel like the kid who gets to sit at the smart kids table during the exam, so I'll be looking over your shoulders. But thank you for airing. I've learned a ton from the experts on this panel and from the audience. And really want to thank also Scott for having the vision to bring you to this leadership position, Larry. So thank you.
Thank you. And last but certainly not least on the panel of the Fab Four, we bring back an old favorite, and I stress old, but Dr. David Chansom. Dr. Chansom is the head of infectious disease and has been the leader really around the state on COVID for the Integris system, and has been on numerous programs and really has been an expert on this panel really teaching all of us. As an older physician, I don't really treat COVID, and I've learned a tremendous amount from his expertise. So, David, thank you for your wisdom. Thank you for your attendance, and thank you for your friendship.
Thank you very much. It was certainly been a pleasure, and I've learned quite a bit from you, from the commenters, and most of all, probably from Dale. All I do is regurgitate what Dale says.
Well, and last but not least, Scott Mitchell, thank you for being the producer. Thank you for allowing us to have this time and putting this all together. So a big thank you goes to you. And I want to also thank all the viewers. We've had thousands upon thousands of viewers over the last 3 years. Without you, Channel 9, Channel 6 wouldn't have continued this. So thank you to Scott, and thank you to Channel 9 and Channel 6.
Well, thank you. And while we're talking about folks that made this happen, which we hope contributed to the culture in a way that I'm going to show you a couple clips, by the way, that is in a positive way. When we started this a long time ago, Ryan Welton, who's the digital chief at News 9, News 16, it was really when that game happened between the Jazz and the Thunder, Dr. Chansom, I'm sure you remember that well. It was within about 48 hours we made the decision to do 60 straight days of these streams, and then it kept going 2.5 years later. And Ryan wanted to have a word, not only with our audience, but he's been behind the scenes the whole time, and he has a special appreciation for the Fab Four and the Fab Five, and this is what he sent us earlier.
Well, it's the end of an era. For 2.5 years, doctors Armitage, Chansolme, Bookman, Bratzler, Sublett have informed and educated Oklahomans on the COVID-19 pandemic through the guidance of our venerable host, Scott Mitchell. And the Fab Four has grown to be a digital mainstay in Oklahoma news and public affairs and health coverage, an important part. From the early days of COVID, when none of us really knew what it was a 101 class in learning how to avoid the disease. And then as vaccines became available, it was an education and advocacy program for folks to know what to expect from the vaccine, where to get it, and an open discussion, a no shame space, a safe space for discussion about things like side effects and calming the concerns and nerves of Oklahomans statewide. At Griffin Communications, our mission is to keep Oklahomans safe, informed, and entertained. And all three of those things you guys have done in spades with aplomb over 2.5 years. Hundreds of thousands of digital viewers since March 2020. It's been really incredible, and I've enjoyed it not only from my digital content perspective, but also as a viewer. It's been very educational for me, and it's helped me talk to family and friends about the disease in its pandemic and endemic stages, about the vaccine, and allaying their concerns about both the disease itself and treatments along the way, and dispelling all sorts of rumors. Dispelling disinformation is such an important part of what the Fab Four have been about since March 2020. And it has been a public service. You should feel proud about it. And hopefully we don't have to do this again. Hopefully, there's always going to be something next, but hopefully it's not anytime soon. But I have to tell you, both as a digital content professional in my role here at Griffin, but as an Oklahoman, I'm extraordinarily grateful for the work that you've done. Week in, week out, it has been the singular best spot for on-the-spot, no bull, no disinformation, information about the COVID-19 pandemic. And I'm extraordinarily grateful. I appreciate your friendship, and enjoy the time off.
All right, so that's our buddy. And I've got 2 more clips before Dr. Bookman takes the program and I get out of the way. Let me start with the first episode that we did, a little bite here. This was days after the Jazz Thunder cancellation. This is when we had a studio down at Tower Theater, which within about 30 days we'd abandoned because we were so frightened by. Youngest one was my producer, Joey Mitchell. Some of you have seen his work. He's taught his old man how to do this, but this was like, for example, I said, I want to do something before Dr. Chansom steps away. So this is his work, so we had some fun with that sort of stuff. And
right.
So anyway, but I've got one more clip for Dr. Chansom, but this is exactly what it looked like in the midst of all the fear and fright in 2020, March of 2020. Here's just a little bite. This is the second episode of the streams that we did. See if you recognize any of the faces.
There is a shortage of test kits right now, and it's nationally it's happening. So I've been on the phone with our federal delegation, letting them know that they need to pull every lever they can to make sure Oklahoma gets the test kits that we need. And so this is I know Oklahomans are anxious and fearful, and what does this really mean? And I'm actually anxious to talk to you about, from a medical perspective, what can we expect? But Oklahoma is doing everything that we can right now to mitigate this the best we know how, or from the recommendations from the federal government.
And many of the items you've brought up, we're going to talk more specifically about. The first that's very important is what you just said, communication. We've got to get anxiety and the fear of the people in Oklahoma calm down, that things are underway, things are being done, and getting accurate, important information out on a regular basis, I think, is very important.
So that was, by the way, did you see how far apart you were sitting for the governor, Dr. Bookman?
Oh, yeah.
That was actually, we measured. We did measure that, okay? And Stephen Tyler helped us at the time. We made sure it was.
Was that political or social distancing?
Nothing to do with the transmissibility of the virus.
Yeah, no comment on that, but I did have more hair back then.
So I will tell you, by the way, Dr. Bookman began to, he put the beat on him going, well, we'll have somebody show up every day. It was by the way, you can go back on the Mitchell Talks page and see all of those videos. It's pretty interesting. Okay. And then later came the Fab Four. This is just a clip, and some of us look even younger. I'm not in this one, but this is pretty good. This is, or maybe I am, but ignore that. This is from the very first Fab Four program, which would have been a couple of months later. And these are just real quick clips out of no reason. I just pulled them out of midair just so you can see what the first one looked like.
I agree. I think that certainly until we have a vaccine, and even then it will continue. But certainly right now, there's no end in sight. Everybody needs to take it seriously. I still am amazed at times, the number of times I see reported that people say they thought it was a hoax, or they thought it was a political being made up by politicians. We've had more than 150,000 deaths in this country. This is not a hoax. It's not being made up. It's a real virus, and people certainly need to take it seriously with all the social distancing, wearing a mask, and washing their hands that has been advised since the very beginning.
And the fact that the Academy of Pediatrics nationally has come out with a statement that, yes, we want children back in schools, but with the strong point made following that it needs to be safe, and we need to take precautions and do the best we can to keep not only the students, but all the personnel, the families that are involved, as safe as possible. And so that's, of course, a big goal of us as pediatricians, to be looking at that closely and see what we can do, what recommendations we can make. So, yes, I would be in agreement. A vaccine is what we're hoping for as soon as possible. But
well, I would agree with my colleagues here. The end is not in sight, but I would say that our present is probably a better present than we had several months ago. I think the acceptance of masks, the awareness. There are fewer people who don't take this seriously. I think another really positive for us all making it through to the end of the tunnel is that people are getting better at adapting, whether it's businesses, whether, I believe schools, while not as good as being in person, will be better at a distance this coming fall because people are adapting and learning. And I would say the end is not in sight, but the present is better. And
we'll put hydroxychloroquine to the side. I don't use it. I have not prescribed it. I don't recommend it. Next, the dexamethasone has been the biggest breakthrough. The huge study, the recovery trial out of Great Britain, showed a significant mortality decrease. And if you ask, I think most of us who are taking care of this on the front lines, the three things that have made the biggest impact in this disease in the hospitalized patient. I'm not talking about the person who stays at home who can't smell for 2 or 3 days. I'm talking about the hospitalized patient. Dexamethasone, number 1. Number 2, convalescent plasma. I cannot, and I know Dr. Armitage is going to talk about it, so I'm not going to say much about it, but yes, plasma. And number 3, remdesivir, which the state has done a really good job of supplying to its member hospitals. We have to make some tough decisions because it's a fixed resource. We only have X amount of drug and we have 2X amount of patients. So it's tough sometimes to kind of see who you think needs it the most.
So that was a little snippet of what the conversations were like. Does that take you guys back? And my last point.
Yeah, I changed my mind about hydroxychloroquine. I think it's great.
Okay. All right, and here's my last point, and Dr. Bookman, take it over. I had to do this. I never got rid of this clip because this was Dr. Chansome's favorite moment of the entire series. You know what's coming, Dr. Chansom?
Quarter 3.
The Turnpike in Tulsa. Pryor taking on Bishop McGinnis. Winner faces Tulsa Memorial. The Irish work in the corner. Luke with the 3, then Dawson Alt from long distance, but McGinnis still in advantage, still in front. Other end, Irish. Graham Tawater connects. That makes it a 7-0 run at that point for the Irish, and they go on to win tonight in Tulsa by a score of 68-59.
Okay, so that's Dr. Chansom's favorite moment. You want to explain that?
Yeah, number 0, the corner 3, the lefty. So that's my boy. He's now a freshman at TCU. He's tearing up the intramural circuits. He's not actually playing for the Horned Frog, shockingly enough. But yeah.
Okay, well,
he finished up. I guess he's a sophomore now. Whatever. I should.
That takes us back. Okay, Dr. Bookman, I hope you guys enjoyed our little tribute, but we've got work to do. Dr. Bookman, take it away.
Thanks, Scott. And again, thank you to all the listeners. If we don't get a chance at the end, I just want to thank each and every one of you for listening weekly for a long while, and more recently once a month. This will be our last show, so hopefully we can sum it all up and look to the future. But we're going to start off tonight, Dwight. A lot of new things since we were last on the air about pediatrics. We've got 6 months and older. You want to tell us what's happened and what parents can look forward to?
Sure. Just a couple of quick stats. The total number of pediatric cases since it started is right at about 13,700,000. We, as you know, started out pretty slow as far as hospital stays in the first strains of COVID, but with Omicron, that had went up drastically. So the total number of cases that we've seen in the pediatric community made up 18.8% of the total cases that in toto. But anyway, the good, I've got good news and bad news. The good news is that after 15 months of waiting, we did on June 15th get the vaccine for the 6-month to 5-year age group, which is great. And I really want to encourage parents to get in with their doctor, with their pediatrician, or family practitioner, or whoever, and get that started. COVID is not gone. It's slowed down at the present time, but as we know, it takes many twists and turns. So I'm going to encourage parents to get involved with that. We've had the Adolescent Vaccine, the 12 to 17 year age group, since May 12th of last year. nationwide, 69% of that age group has had at least one dose of the COVID vaccine. That's what they, this is from American Academy Pediatrics, where I'm getting the data from. 59% have had both dosages, the initial dosages. That's good news. Bad news is we're not doing great. We're still not doing great. About in terms of the first dose, 55% of Oklahoma adolescents have gotten it, and having both doses is about 45%. So we're lagging there, but that's the best compliance we have. When we look at the 5 to 11 age group, which we got that vaccine in November of last year, we are only at 21% that have gotten the first dose and 16% of having both dosages. Nationwide, that is 36%, and the second dose, 29%. So we're lagging there. And Dr. Bratzler, you may have data that I don't have. I'm getting this out of AAP. So if I'm incorrect on that, do correct me on it. But good news is we now have a vaccine for all along. And also good news, both the Pfizer and Moderna vaccines have been approved for that age group from 6 months up to 17. So the availability ought to be there. The schedule, if people want to get the schedule, they can go to aap.org, and it is listed there. It's listed in a lot of places, and you also can just talk with your doctor, and they can help you work through the schedule. I'm not going to go into that because that's rather detailed. But that's what I want to report. Paxlovid is for the greater than 12 years of age up. Need to be at least 88 pounds to get that. That's another option we have now. So there's a lot of things that have popped up. But the big items is the immunization. And I'm just going to sincerely encourage parents, get the vaccine. It works. It's good. And we've had enough experience that we feel very comfortable recommending it to you.
Thank you, Dwight.
Thanks. You bet.
Dale, do you have anything to add to the pediatric aspect?
No, not to the pediatric aspect. I think we all know in Oklahoma, we haven't done great on vaccination in general. Less than, only about 60% of Oklahomans are fully vaccinated. There's a big chunk of people that still need to get vaccine.
Yeah, I'd just like to add for parents to understand that Moderna is a 2-dose vaccine, where Pfizer is a 3-dose vaccine. Right. And I think most importantly is where can they get the vaccine besides their pediatrician, which I recommend all parents talk to your pediatrician. Mm-hmm. But Costco, Walgreens, and Walmart are only giving it to 3-year-olds and above. CVS is giving it to 18 months old and above. So if you're looking for someplace other than your pediatrician, CVS is doing it at 18 months. And I think that's important for everybody to understand. But I encourage, as Dr. Sublett said, talk to your pediatricians. That's the one you need to go to.
One other thing, I don't think you have to stay with the same brand all the way through. You can you can switch back and forth if you need to do that to get it. So
yeah. Well, let's go on to what the state of COVID is today. Unfortunately, a report came out yesterday, I believe, that the Commonwealth Fund's 2022 rankings was not complimentary to Oklahoma. We ranked 50th out of 51 on our response to COVID. Some of it had to do with the percentage of people who are vaccinated. Some of it was our ICUs being full more than 80% of the time. We were one of the worst at that. There were a lot of factors. Dale, you want to talk about the state of COVID today?
Yeah, so let's just kind of talk about where Oklahoma is at. So through last Friday, Oklahoma has seen 1,071,000 cases of COVID-19 in the state, with more than 16,000 deaths. The Commonwealth Fund, as you mentioned, ranked Oklahoma 50th out of 51 with respect to the response to COVID. And as you pointed out, Dr. Bookman, the part of it's the vaccination rate. Another one of the reasons that they ranked us fairly poorly is the excess mortality that we saw from COVID-19. So in fact, just a couple of weeks ago, Johns Hopkins came out with their analysis of death rates from COVID-19. and Oklahoma ranked third in the nation with respect to the highest death rate from COVID-19. Mississippi and Arizona were the only two states that had higher rates of death from COVID-19. Right now in Oklahoma, in the past 2 weeks, we've seen almost a 50% increase in the number of cases being reported. But even more impressively to me, since the end of March, we've seen a tenfold increase in the number of cases that are being reported on a daily basis. So we're over 700 new cases a day, and that's only patients that we know about who went and got a test at a laboratory that got to the state health department. We know a lot of people in the community are getting testing done through home test, and none of that data shows up in the state's official numbers. Finally, the last thing I wanted to highlight was that the CDC does publish variants, the variants that are circulating in the regions of the country. And as of this week, 95% of the new cases in our region of the country are due to one of the 3 subvariants that are highly contagious and that we now know have some ability to escape antibodies from previous vaccination or previous infection. So the 3 subvariants are the BA.2.12.1, BA.4, and now the predominant one in Oklahoma is BA.5. So highly contagious. People are getting reinfected. They've previously had COVID, they're getting it again, or they're vaccinated and they're getting COVID. The good news is if they're vaccinated, most of them aren't ending up in the hospital.
And I think that's the important thing. I can tell you, we talked about it last time on the show. I was quarantined in out of the country because I tested positive, but I had my second booster 2 to 3 weeks prior to leaving the country, and I really had no symptoms. I tested positive, but I basically had no symptoms, had a little runny nose for a day, but never felt bad. My wife also tested positive. We were both quarantined, and neither one of us was significantly ill. So she had flu-like symptoms. I didn't even have that much. So I stress the importance. Getting the vaccine, getting the boosters does make a difference. It doesn't prevent you from testing positive. It doesn't prevent you from being exposed to the virus. It doesn't prevent you from having any symptoms. It prevents you from getting really sick. And we're going to go to Dr. Chansom and talk about the hospital, but it prevents you from seeing Dr. Chansom in the hospital.
It's not a pretty sight.
David, tell us what's happening in the hospitals before we move on with current COVID.
Well, it's getting busier. It's not like it was, thank God. But we're certainly seeing more patients. I mean, there was a little while there where we, in the entire Integra system, I don't think we had a single patient in the hospital that was actively infected. We kind of classify them differently. We still have a lot of people in the hospital who were had been in the hospital for a couple of months or something like that. But there was a little time there where we didn't have any, and it was a very short time. So we're starting to see that come up a little bit. There's some people in all of our hospitals, and that's tough. You can kind of see people starting to get that twitch again, like, oh my gosh, are we doing this again? And you hope we aren't, but we'll just have to see. We're getting pretty good at playing the game, and we're able to turn on some of those things that we've been able to turn off a lot quicker than we used to. So those things are good. But I think the data that Dale was talking about with that you were talking about from the Commonwealth Fund, the 50 out of 51, it's really, really tragic, because if y'all remember when the vaccines first came out, Oklahoma was in the top 10. Remember, I think we were number 7. And there were lots of people touting that. I think it happened in spite of those people, but they were happy to take credit for it. And if they were taking credit for that, they have to take credit for this too, because we had an opportunity there to be better than we are. Now, I think I take issue with some of it. I think they're applying metrics across the board that aren't necessarily fair. I can tell you, I don't remember the last time my IC was less than 80% full. there's a shortage of hospital beds in Oklahoma. We only have them in 45 counties or something like that. So I don't necessarily know that the math can be evenly applied around the country, but we have to accept the fact that we routinely rank in the bottom 5 in all statistical categories of health, no matter what it is, be it diabetes, smoking, teen pregnancy, whatever you want to take. So it's not a surprise, sadly, to see that we're in the bottom 5 again. But we had an opportunity. We were the Boston Celtics. We were up 2-0, and then then we kind of went down. So the hospital, the morale is good. We are still the tough part now is even, where are we now? June of 2022. So 28 months later, after COVID started, we are still paying the price of all of those things that didn't happen. Our hospital's full. I'm sure OU's full. Mercy's full. Saints is full. I round at Saints a lot, so I see that they're full. And what's happened is we're paying the price for all of those things that we had to put on the back burner for a while. People not getting screening colonoscopies, not following up regularly with their cardiologist because they were afraid to go to the doctor, not wanting to get out. I mean, and I'm not bagging on these patients or anything. People were scared to leave the house. If you're a 75-year-old person with a bad heart, you were afraid to leave the house, and unfortunately, we're having to pay some of that back now, and so our hospital is still pretty full with a lot of sick people. But luckily, COVID's not a huge problem right now today in the hospital. I have called in more Paxlovid in the last week than I have since the drug came out. Luckily, we have some. But I think all of those have been home tests. To Dale's point, I don't know a whole lot of people who are getting the testing through the old system. So we'll see kind of how that ends up playing out.
And it's not surprising that our death rate would be one of the highest, while COVID is the being explained or being blamed. We also are one of the worst in the nation in obesity. And, you could go on down the line, smoking, alcohol, etc. So with all the comorbidities that Oklahomans carry, it's not unusual, or it wouldn't be out of the ordinary to think that we'd also lead the way in deaths from COVID, because that certainly was the underlying causes.
On the Commonwealth rankings, one of the interesting things to me is the high pressure we put on our ICUs and the number of days we were straining our capacity and overworking our physicians and nurses and support personnel, respiratory therapists. We talked a lot about on this show, but now we're sitting on top of CARES money, and we're looking at this budget surplus. And it's sad that we're not looking at, we ran too lean and mean, right? Well, essentially what this says is driving healthcare by the bottom line and squeezing the profit margin exposes you. And it's the same in our supply chain. We're seeing the same lessons that when you bring down price and you remove backup production lines and skinny, you leave yourself exposed. And I don't think we're having a very honest discussion about, that's one of the things that we should be committed. We had hero nurses and respiratory therapists and physicians and hospital workers of all types, but we're not now paying attention to, what's the payback for those people who put their own lives on the line for us. And we worked them like dogs because we didn't have enough beds and we didn't have enough resources. Well, we can't make that excuse now. We've seen that running to the narrowest margin leaves us exposed. So I would hope that we can take some of the substance of that report and say, what can we own and change? If we've got a little bit of extra money, I love that we're trying to support nurses training and That's a great step forward. Yes, let's train more people up. Let's bring more people into these critical professions. But let's also think about how we have a bed that's open in a location that might not be 100% occupied all the time, because actually you need some overflow capacity in worst case scenarios. And it's just like building a storm shelter. Do you build it for an F1, or, do you want a, F4 or F5? It's not a lot of point to building for F1, a small amount, but build your healthcare system around the kind of challenges we just basically failed at. So.
Well, I agree. I do want to at least add to what you just said and give the College of Nursing and the state credit. They are basically doubling their admissions. The key to that is we've got to keep them in the state. It doesn't help to get them graduated if they all go elsewhere. So the state has to step forward. We've got to get the graduates, the nurses. We need more doctors, therapists, etc. But we've got to keep them in the state of Oklahoma. So the state needs to look forward to that.
And just along the same lines of what can we do as an after action accountability for us all, and particularly those of us in healthcare who were up close and personal, we realized we didn't have the muscle in our public health departments to do the testing. We didn't have good surveillance in rural areas. I mean, there are gaps that were glaring that at the time we muddled through and did the best we can on a lot of heroic extrapolations and people working to try and make sense of partial data. But that's sad. Don't we have the resources to put some of our wealth towards the protection of our most vulnerable? Because our state is full. Unfortunately, one of the other lessons that I hope in the after action, if there's ever a wonderful conference that tries to distill any of that, is we're at high risk because we have high comorbidities. Vulnerable. Well, that's a third of our state easily. When you look at risk factors, well, a third of the state is a huge chunk of the population to put some time and effort and resource to protecting.
I agree. Any other comments on that?
I'd like to make one comment. We emphasized a lot down the pike about the mental health aspects of this and how it affected so many people in the child population. Depression, anxiety just went out the roof. We've had a lot of trouble. There has been some strides forward in that area in the legislature. At least it's starting to be addressed. But that's something that, along with what John's talking about, we need to be putting some emphasis on. We're sorely lacking in that area as far as availability of professionals. So I'd throw that out.
Well, to me, this is, I don't know what TSET's doing with its next round of funding, but some sort of after action, pull together some, nonpartisan preferably, or bipartisan or some sort of nonpartisan, put together, some people who can sit around the tables for a day and really try and distill some of this. Somebody's got to come up with a plan. Otherwise it's going to be piecemeal, and it's not going to make the maximum use of our resources to address the deficiencies.
Dale?
Yeah. So I heard recently in the public health literature, there's a term called the slow pandemic. And let's be realistic. We're not seeing nearly as many deaths from COVID now, but cardiovascular disease, cancer in Oklahoma are the two leading causes. Continue to be the leading causes of death. And just as Dr. Chansom mentioned, so many people did not undergo screening, did not get routine follow-up. We're going to see a lot of patients die from those other diseases that have been around a long time. Oklahoma has the highest rate of death from cardiovascular disease in the nation. I think we're fourth highest in diabetes in the nation. We have to start addressing those from a public health perspective because, as others have mentioned, we had such a vulnerable population who got infected with a virus that took them out, that caused severe complications because of their underlying disease.
Yeah, I think that's something all of us as health professionals, and especially if you're involved with the political aspects of medicine, that's something we've got to do, and not look to the future. It needs to be done now. It needs to be started now, and at least the discussions do. So, I agree, David. We've got vaccinations, we've got boosters, we've got people asking, do I get a booster now? Do I wait till the fall? Now we've come out with what I'll call Omicron specific or subvariant specific booster and vaccinations. Where does all this sit? What should the people be doing, and what should they know?
Well, you should know that the recommendations haven't changed from the last, 6 months, I'm going to say, which is people over the age of 50 should have the original 2-shot series plus 2 boosters. People over the age of 12 with comorbidities, same thing. So those recommendations haven't changed. Now, there was a very interesting meeting yesterday with the Vaccine Advisory Committee at the FDA about some of the tweaks that they're talking about doing with the vaccine. Like Dale said earlier, the currently predominant subvariants, BA4 and BA5, and to some extent BA2.12.1, I guess, also do have a fair amount of immune evasion, meaning that they seem to be able to evade some of the immunity that was offered from the vaccine and from native disease, which is concerning. The idea is that because messenger RNA was developed very, very quickly, they were able to roll it out quickly. The scientific part of it was actually fast. The hardest part with getting vaccines out is actually the packaging and shipping of it with the messenger RNAs. They can actually produce the molecule pretty quick. So that's a real asset when you're talking about trying to chase a rapidly changing epidemic like Omicron COVID. So yesterday they had this vaccine advisory committee talking about Pfizer and Moderna were both, and I believe Novavax and maybe another company too, all presented data on tweaked messenger RNAs, because we're still using the same messenger RNAs that we used in December of 2020. So tweaking the messenger RNA to be more variant specific, and it got I think the vote was 19-2 or something like that to go ahead and go forward with that. Now they voted on that, but that doesn't mean that will be on the shelf until I have read early October at the best, probably more likely late October or November. But I think it's going to be kind of like the flu vaccine. This isn't a new concept, right? I mean, this is what we do with the flu vaccines every year is we look at the predominant strains that are rolling around. They don't change quite as quickly as the COVID vaccine, which makes a little bit of a moving target. But they package several different. So they're actually, most of the flu vaccines are either trivalent or quadrivalent, meaning that they have 4 different subtypes in them. I see a day when the vaccines are going to be like that as well for COVID, where they'll probably take what was the most common last month, this month. The difference, of course, is that influenza doesn't move quite as quickly as COVID. And so I mean, I'm a little bit concerned if you look at the variant maps of the maps of variant progression. I mean, Dale, on the last one, those bars that they have that are all color coded are a week at a time, I think, right? And I mean, you will move across a variant and it'll be out of style. I mean, it's like my wardrobe; it's out of style 3 months after I buy it, right? And so, you've already moved on to the next variant, so that's going to make it tough with the vaccine cycle to keep it in. The bottom line is keep an eye on the recommendations. They are not recommending a 5th booster right now for the most part. Maybe rarely in profoundly immunosuppressed patients. There are other options out there, but keep an eye on that. Talk to your physician or your practitioner about it to see whether or not you're eligible for, and for God's sake, get it if you haven't yet. Like Dale said, we're still woefully shy of the national average in terms of vaccination rates in this state, and we need to get them up.
Yeah, so I'm going to say something maybe a little bit controversial. So, but I took my second booster also. I'm above the age of 65, so I took my second booster, and I had a big concern though because I wasn't convinced that it was going to give me that much additional protection. Right. And I thought, should I wait until the fall? And I talked to an immunologist at NIH, and they said, well, you're right. The studies haven't shown that there will be a huge impact in terms of your health, in terms of getting the fourth dose, that second booster. But they also said, I can't think of any reason not to do it. And so I went ahead. I was getting ready to travel, and I wanted to be boosted before I traveled, so I did. But I think there is a good chance that we may have either a bivalent vaccine. Moderna has come out with their data on their bivalent vaccine, which includes the new Omicron spike protein. So 2 different spike proteins in the same shot, or the enhanced, Omicron specific vaccine in the fall. I think it's likely we'll see it. I'm like David, I don't know that we'll see it before November. But I still, particularly for people who have concern, they're older, they have any underlying disease, which is a bunch of Oklahomans, I'm actually recommending they go out and get the second booster.
I agree. I've had multiple people, friends and old patients call, and I've told all of them who are over 65 to get the booster now. I also tell them I believe we will need another booster, whether it's in 6 months, a year, I don't know. But I do think we're going to need future boosters, much like the flu. We get one every year. So, and I think this disease is trending more to be like the flu. You get the booster, your symptoms are flu-like. So get the booster. That's the bottom line.
Well, one of the things I think implicit in the comments here is that the government's going to continue to subsidize, appropriately so, the development and the distribution of vaccines. I hope we don't lose track that accessibility, at least on the policy side of the equation, maybe not on the advertising and the influencer and all the marketing side of it, but we've been very fortunate to have something of a bit of a blank paycheck or blank check to go and chase some of the public health goals on this. I hope we can maintain that. I'm not sure that, given 2 or 3 years, our memory is going to be strong enough to keep that kind of open door access going.
They're already rolling it back. I mean, they had recognized that hospitals were going to be stressed with people who were underinsured or uninsured. And they recognized that, and there was a subsidy program for that. And that there's no way any hospital in this state for sure would have survived without it. Right. And frankly, they're kind of having to learn to live without them now too, because that program has, I can't remember, was it CRSA or something like that? I can't remember what the name of it was, but so they've already taken that away. Some of the drugs that were available from the government, for example, remdesivir, and I believe some of the monoclonal antibodies are no longer being subsidized by the government. I hope and pray with you, John, that they will continue to roll out the vaccines aggressively, so that, because that is money well spent.
We already know there's a good chance that there will be no more monoclonals after this latest round, because the shelf life or the useful life of those drugs is so short. It's not. Unless somebody's going to say we want to have this in our bag of tricks, the market probably won't bear that kind of R&D for an 18-month drug, or even worse, a 9-month drug. And those decisions are going on, and the people who want to remember how important it was to have tools, remember how happy we were in the end of the first summer of 2020 when we started to get, I think even the clip, when you were talking about some of the early advances in, we're not sitting here looking at people on ventilators with nowhere to go. We're starting to bring in our usual wonderful medical armamentarium, and we're losing the armamentarium, and nobody's sort of raising their hand and saying, wait a second, we had 5 treatments, we're down to 2. We need to remember. Americans are not the best sometimes at remembering. We move on, which is one of our strengths, I think, but it can also leave few gaps in our wake. And this will be an unfortunate gap because it's going to be really hard to, I think we were talking earlier about good things out of COVID, silver linings, and that teamwork we were talking about where so many people were working to get to yes. I don't think COVID's probably ever going to have that unless it gets rebranded as some new virus. They changed the name. COVID, I think, probably played out for that ability to galvanize that same teamwork. It's too politicized, and it's yesterday's news, unfortunately, to some people. But we've got to fight to slow that decline, that de-evolution of our medical advances, essentially.
Well, John, that segues directly into your topic for tonight, and that is, what is the future? What's going to be normal? And I know you can handle this with aplomb. So,
well, I think I deflected earlier on the call. I was talking about trying to take some of the positives, because I do think that part of the new normal, if we're going to learn from our failures, let's learn from our successes too. And there were a lot of them. We were talking about the teamwork. I know the FDA in blood banking relaxed some rules that I thought would never change in order to make blood a little bit more available. I think they fast tracked and came up with new ways to get products to market, and then sort out the winners and the losers based on efficacy. So there was a whole paradigm shift that happened so quickly. And the other thing, along with that kind of collaboration, the media stepped in, including this show, to fill gaps and keep people informed and safe. And that was, that's not always the case. There was a real sense of urgency and everybody banding together to get to positive answers. And we recognized heroes we don't usually. I remember when we were celebrating the retail clerk, which was a wonderful moment. When we realized that those people were so essential to our lives, and pizza delivery people saved America, I think, in the month of April 2020. Again, we had moments where we recognized, the sacrifices of nurses and respiratory therapists, and the everyday heroes got a little bit of limelight, and now it's moved on. We're back to the, forgetting about those people in a way. But, there was a moment we can look to that said, that was a real positive. I think we learned more about public health and the importance of hand washing and, basic, hygiene, or, don't cough on people. And, we learned a lot more about masks. N95, I look at somebody wearing a cloth mask now, I'm like, what's that about? That, what is that, kabuki theater or something? It's my non-mask mask. But at any rate, so I think there were positives out of that, and we did muddle our way through. But I don't think America's a country of muddlers. I think we're a country that's built on really smart people looking at a problem and owning a solution. And I hope we can see more of that in the future. Communication, we talked about it, a key. Maybe it's a specialty in public health, but health communication. We need to figure out how to use modern influencers, modern tools, social media, and get the right voices amplified and drown out the chatter and the static. That's an art. And I hope we develop the skills to go into what is the modern battleground of information, which is social media. Why are the guys, the white knights, riding, rocking horses? They should be on the turbocharged, whatever, Clydesdale, whatever. My analogy is getting all screwed up. But what I'm saying is the best minds need the best tools if we want the best results. And so hopefully we improve our communication, and value it. Create the specialties, create the tracks where, every hospital should have somebody trained in how to explain science to the public, because every hospital is in the game. The more science and good information, the less burden on acute care. And, it's the pathway for education's the pathway forward in so much of our challenge. So those are some of my ramblings. I got a lot more here, but
it's fascinating, John, that last part that you talked about, what we have to learn about communication. I think for so many decades, doctors and healthcare practitioners were in a place where they could just say, I'm saying this, so and people would listen. And I don't think it's necessarily wrong that we're being questioned on the way we deliver information. I think we have to be able to talk to our patients in words that they can understand. Enough of this, because I say so. So my daughter was a strategic communications major at TCU, and she actually did her senior thesis on the role of influencers in COVID communications, and how, near the end, some places started to recognize that some local health departments, particularly in places that are a little bit more technologically savvy, started to recognize that was really important, and really getting down to a very granular level on the way they communicated these things rather than putting out these blanket statements. I think that's one of the most important things the CDC needs to take away from this. And I think you're absolutely right, John, when you say that all of these places need to have not just maybe a communications person, but even a communications team on how to appropriately, because it's not one message. It's got to be several messages going out to different kinds of target populations. We are not talking to people in Oklahoma County or in healthcare the same way that we're talking to people who are maybe in the restaurant industry. We have to have different conversations. We're not talking to people that are in Oklahoma County necessarily the same way we're talking to people in Alfalfa County or something like that. There has to be different messages delivered. And just like we talked about the data from the Commonwealth Fund, they're in a single tool to the entire country. I really think there's different tools for different places that you have, and that's where the nuances of communication come out. I do still believe the most important interaction is the one-on-one patient practitioner interaction, and we have to be good at communicating that. But then we have to depend on our bigger public health entities and things like that to be able to communicate effectively to broader swaths.
And I would add, David and John, not only, yes, the way the message is delivered needs to be individualized or different depending on the group, but the message needs to be consistent. And that's one of the problems the CDC had, is that it was here, it was there, it reversed itself, and people lost all confidence. We've got to be able to deliver consistent messages, even though there may be different forms of that message.
Right.
Yeah, I have a note from herd immunity. That was such a mantra for the first 6 months, and I haven't heard herd immunity. Because we are having people now. Now we open up this whole wild card of home testing, and we don't know what the real infection rate is. We can maybe extrapolate. But that whole concept was so important to us at the beginning, and then it seemed to melt away. So we don't do a very good job of setting goals and then staying after them. It was going to be 70%, and then it was going to be 80%, and now we don't talk about herd immunity, and we've moved on. And I think there's still people out there who said, well, you never gave me the punchline, or you never tied that up for me. So you've lost credibility in a way. The answer may be to say we've moved on, and because of reinfection and because of, certain things that's no longer as applicable a concept for us, but move on to the new. If it's not herd immunity, it's herd partial immunity to keep you out of the ICU, or it's a something. Consistently, we owe it to ourselves to know that those loose ends, as we move on, we got to pull the herd with us in that understanding of why that's not an important metric anymore, or why we're not as concerned about that.
Well, gentlemen, it's been a delightful and informative hour. The hour's gone fast. Before we close shop, Scott, do we have any questions from the viewers?
We have, I think you've answered most of them, but I wanted to put some of these folks up because these are folks that have been with us from the get-go. And I recall in March of 2020, Dr. Bookman, you'll recall, we were getting questions going, here's what my BP is. Do you remember those days? Right?
Yeah.
I mean, Dr. Bookman was like the Oklahoma's answer man. right down there at Tower, and we were having these discussions. Here's Barbara Brockhouse. You all have been amazing. Thanks for everything. Thank you, Barbara, for watching all this time. Larry, it's been a great time listening to all of you. Sherry's. There's a little bit of a message there. Your information was so well presented and honest. The first line is, which reminder, it's an election year. Also, Bryn, really appreciated this timely discussion over the past 2 years. Thanks to all of you. And I think that's pretty much the sense of what people have done over the last year and a half, 2 years for this, the panel. So I do want to say thank you to everybody, the doctors on the panel. It's an enormous amount of time. I don't think, Dr. Book, we've done many of these as premieres or pre-records. These have all been done live. And then for a while, I would watch in the background Dr. Chansom, especially if the Saints were playing. I could tell how they were doing, just from looking over your shoulder at the.
I'm not a baseball guy, so I'm a man without a sport right now. I don't know.
The USFL is playing, David.
So, and then we started, and have felt for Dr. Bratzler over time. When I would watch those press conferences, I don't know if you guys remember back at the start of the first Gulf War, Saturday Night Live was making fun of the media. And it was guys playing Cheney and Schwarzkopf and some of those. And just before they invaded Iraq, and media people that were Saturday Night Live characters would stand up and go, "Where are our troops hiding? And what time are they going to attack?" And I would see Dr. Bratzler fielding those questions, and you wonder just exactly what planet they just came from. And Dr. Bratzler, you were so kind, because you get press conferences are oftentimes there's some good questions, but a lot of times they're just stupid. Okay, and so they're not listening to what the other person has said, and so great respect. And then, I remember at the very beginning watching those videos that Integris was putting out with Dr. Chansom in the space outfit, and letting people know what was happening behind the scenes. And we still had people saying hoax, and I really appreciate that. Dr. Chansom taking all that time. What was a day like for you, Dr. Chansom, in, let's say, of March of 2020?
In March of 2020, I spent about 18 to 20 hours a day, I think, at the corporate suite at Integris. It was when I was supposed to be gone on spring break, and everything had kind of shut down. So there wasn't any patients then. We were learning. It was, that were really fun. We were learning so much, talking to friends from Atlanta, from Seattle, from New York City, and just learning about the disease. But more than anything, and I'm sure Dale would echo this, we were talking mostly about how to keep our employees safe and how to keep our patients safe. I think that's what the biggest things about March 2020. How can we keep equipment clean? How do we make sure we have enough masks? How do we make sure we have enough gowns? And you know what? I'm glad we talked about it, because it all came up later on. And that was some of the neatest stuff. But those days were exhausting. And I looked at that first clip that you showed, what I looked like back then versus what I look like now, age 10 years. The worst for me was probably the Delta wave, or maybe even the summer before that. Mm-hmm. That was I look back on that, and I can't believe that the hospitals made it. That was unbelievable. Really unbelievable.
And Dr. Sublett was trying to get retired, and he was already trying and fighting vaccination battles and trying to help parents be advised. And there's so much misinformation at the time, Dr. Sublett.
Yeah. Well, everything was in real time, and like you were saying, we're getting all these mixed messages. And then, of course, there's a lot of feedback from the internet and everything like that, as far as what we should do, who should mask, when do we go to school, when we don't go to school. It was a nightmare, because being able to give good, reliable information to the public, that was quite a challenge. But we had a lot of people working together, not only in the medical community, but in the state educational department and other places helping us out on that. So, but it was tough.
And then Dr. Armitage, when plasma began to be at the top of the list for everybody, was working those long hours. And I would say thank you to everybody at OBI. I was not a blood donor until I met you and we started doing these shows. And I feel really bad about that. And so I'm pretty regular now, Dr. Armitage. So I'm pretty regular platelet guy. Okay. So
Awesome.
my understanding, and by the way, what a great staff. They will make you feel so guilty when they call you. Okay. It is.
Well, the guilt's yours. We're just tuning into it.
Just delivering the
message. they will make you feel guilty for not giving. I will tell you that and I don't have the numbers down, and then when those sweet voices come on, I'm like, oh man, okay, I feel so
I probably
bad.
should have mentioned that on the positives. I mean, we sat in an essential role, and we had essential donors. We had people who did not give up on moms in childbirth who were having hemorrhage, or cancer patients who were in chemotherapy. It's a shout out to the character of our public in particular, because I think Oklahoma did a better job than most states through this of keeping up the blood levels. But thankfully, what an affirmation that people would still come out when they wouldn't do other activities. They remembered their friends who needed blood, or that stranger who they'll never meet that needed it. So that was one of the affirming things for me is, fellowship was essential, and doing the right thing remained important to so many people. And we didn't forget ourselves. Not everybody. Some people did, but, there's a core of great people out there.
And finally, appreciation to Dr. Bookman. So we've known each other now probably 3.5 years. When I started saying, he was president of OSMA at the time. And I said, all you got to do is just turn on the camera and start talking into it. And I don't think he believed me about what the power of these social platforms. And so it started off, I think you were sort of terming out at the time that COVID really got going, but you transitioned into this. And I know you put in many, many hours to do this, bring this information to people. We should. So thank you all. Thank all 5 of you for taking time to do this, because it's a real pain in the butt. But I got to tell you, I've had so many people say, I really appreciate what the doctors say, especially at the time when the nonsense was at the peak. And if you go back in some of those videos, to see Dr. Chansom and Dr. Armitage and Dr. Bookman, Dr. Bratzler and Dr. Sublett have always been very low key about this sort of stuff. The other 3 doctors kind of lose their cookies on some of the crazy stuff, but it's been a pleasurable thing. I'm very honored to have been involved, and all the folks that have watched this, and it has been enormous numbers over the last 2.5 years. Appreciate you doing it. And we're glad that we were able to do it. And I know that a lot of Oklahomans got some great information. And I would say there was a lot of lives have been saved because of you 5 gentlemen telling people the truth, and for folks that had an ear to listen to what these professionals said. And I've had people tell me that I listened and I did what was necessary, and I'm here today. So Dr. Bookman, Dr. Bratzler, Dr. Chansom, Dr. Armitage, Dr. Sublett, they're not going anywhere. We're just ending this chapter, and I'm sure we'll see all of you again sometime soon down the road. So thanks again. Dr. Bookman, final word.
Final word is thank you to the listeners. Thank you to Channel 9 and Channel 6 and Ryan. Thank you to Scott Mitchell, and a big thank you to all the doctors. As I said at the beginning, I call each of you my friend, and I appreciate all you've done. So until later.
All right. And thanks to all our viewers. Thanks to the docs. We'll see you down the road. Have a good night, everyone.
Night.